When you live with long-term pain, the thought of doing something physically demanding like exercising may not sound as enticing as other activities like watching television. I'm going to discuss some exercise safety tips for people with arthritis and show you how exercise and arthritis should go hand in hand. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can be used as a way to prevent diabetes and many of the complications that often come along with this condition, including arthritis. The content that I'm covering today is going to be based mainly off of the current guidelines from the American College of Sports Medicine and the American College of Rheumatology as of September 2022. In people with long-term joint pain, including those that have arthritis, sometimes exercise can actually make the pain worse. And if a painful exercise experience is the only type of experience that they've had, then they're going to be less likely to want to work out. This could lead to a loss in muscle mass, loss in flexibility, lower aerobic fitness levels, more difficulty getting in and out of a chair, more difficulty climbing stairs. Basically, life gets harder. But many of these losses can oftentimes be reversed through an appropriate exercise program. The American College of Rheumatology even recommends exercise as a first-line treatment for people with hip and knee osteoarthritis. So, meet with your doctor and see if you have any type of exercise limitations before you start your program. In people with arthritis, exercise has consistently been shown to increase energy levels, decrease pain and inflammation, and improve activities of daily living. Muscle strengthening exercises are key to improving the ability for you to do normal everyday tasks. In your exercise program, make sure that you include exercises that mimic some of the activities that you would do in your normal day life, like standing up out of a chair or climbing stairs. Even though it's not part of the current American College of Sports Medicine recommendations, there's been some exciting recent research in the use of blood flow restriction training in people with arthritis. This type of training involves placing a cuff, similar to a blood pressure cuff, on the arm or the leg, and then performing muscle strengthening exercises using lower intensities. There was a recent meta-analysis by Dos Santos and colleagues that found that in women who had either osteoarthritis or rheumatoid arthritis, doing blood flow restriction training at lower intensities was just as effective at increasing strength, muscle mass, and physical function when compared to groups that use moderate intensity strength training and high intensity strength training without any type of blood flow restriction. Now, there's still some more work that needs to be done in this area, but these results are quite promising because if we can use lighter intensities and still get similar benefits, then people with arthritis are less likely going to experience pain whenever they exercise. If you're finding this information useful, please give me the thumbs up and hit the subscribe button. When doing any type of muscle strengthening exercises, it's important to start off at a light intensity and then gradually build from there, as long as you're not experiencing additional pain throughout the movement. If you are experiencing additional pain while doing that exercise, don't do it. There are always alternative movements or exercises that can be done that work similar muscle groups. Similarly, if you're having a flare-up, it's okay to do some light movement through a full range of motion, but don't do any strenuous activity. Now, it's important to distinguish between additional pain caused by an exercise versus normal physical discomfort that comes along with starting an exercise program or doing an exercise that you've never done before. Now, you're also likely to experience some muscle soreness up to 72 hours after the exercise session. This is normal. So it's normal to have muscle soreness after the workout, and it's normal to experience some physical discomfort when you're first starting an exercise program. The good news about the muscle soreness, though, is that it does lessen up a lot the more you work out. One way that you can help to minimize pain is to make sure that you're doing a warm-up and a cool-down. Each of these should be about 5 to 10 minutes long, involve light intensities, moving through a full range of motion, and using large muscle groups like legs, chest, and back. Another way to help minimize pain is to work out at a time of day whenever your pain is the lowest. And sometimes this happens to be at the same time that your pain medications are working at their strongest. Another way to help minimize pain is to make sure that you're involved in some type of stretching program. Doing gentle stretches through a full range of motion can help to reduce joint pain. Comment down below if you currently have a regular stretching routine. When considering shoes for exercise, the general recommendation is to make sure that they have good shock absorption and good stability. Now, another strategy for improving your stability is by incorporating some balance exercises into your exercise routine. Especially for people that have arthritic pain in their lower body, doing balance exercises on a regular basis could help reduce the risk of falling. Some examples of balance exercises include standing on one leg or leaning in different directions. Just make sure that you have something or someone to hold on to whenever you're doing these balancing exercises, like a table or a human. When you first start an exercise program with arthritis, it's likely that your endurance levels are going to be fairly low, and so you're probably going to get tired more quickly than you expected when you first start. Just start off light. Start off slowly with 5 minutes, even less, and then gradually build from there. One good strategy for exercising in people with arthritis is to break up the exercise session into short bouts throughout the day. That way you get the recommended amount of exercise and all the benefits that come along with it. Stick with these exercise and arthritis tips, and you're more likely to start lessening pain while improving your movement.